Hey guys, this is Dr. Mike D, and today I will be discussing polycystic ovarian syndrome, or also known as PCOS. So PCOS is an endocrine disorder in women which may manifest with metabolic, dermatologic, reproductive, and sometimes psychological disorder in women through their adolescence and menopause. So in PCOS, there is increased circulating androgens or male hormones in the body, which causes most of its skin manifestation. And I have here several questions about PCOS, which I will answer today for you. So among my women patients who have acne, ages 19 to 45 years old, I'd say I see around 20 to 40% of them with PCOS. Most women with PCOS would present with facial acne. However, 50% of them would also have lesions over the chest, the neck, and the upper back. So it has also been found out in studies that there is around 20 to 60% familial occurrence of PCOS within first-degree relatives. So if your mom or your sister have PCOS or has had PCOS before, then you're probably at risk of having PCOS as well. Yes, there is a pattern. So women with PCOS can manifest with signs and symptoms of hyperandrogenism or excess androgens. Number two, they can also manifest signs and symptoms of menstrual or ovulatory dysfunction and polycystic ovaries. However, the skin manifestation of PCOS are number one, hirsutism or excessive hair growth. Number two, acanthosis nigricans, which is the development of very thick, hyperpigmented skin over the back of the neck, the underarm, under the breast, in the groin area, and also the intergluteal areas, and in between the thighs. They can also develop alopecia, which is male pattern thinning of the hair and hair loss. And at the same time, patients can also develop seborrhea, which is excessive oiliness and scaling over the eyebrows, nasolabial folds, and the back of the ear. And lastly, acne as well. So in terms of acne, acne can be the sole skin manifestation of polycystic ovarian syndrome in 50% of women with PCOS. A clue would be women presenting in the clinic in their reproductive age, presenting with severely inflammatory nodulocystic acne around the lower half of their face, especially within and underneath the chin and the jawline area. Another clue would be the unresponsiveness of their acne to traditional topical treatment alone. So as you know guys, dermatology is a very visual field, and your board certified dermatologists are actually trained to recognize skin conditions based on visual and pathological pattern recognition. So it takes a lot of years of training before you actually get the clinical eye to be able to decipher which kinds of diseases and associated systemic diseases a patient may be presenting with. So there are a lot of information out there in the internet that are not verified, and your doctors and board certified dermatologists are actually trained to scrutinize and filter out the information that will be most relevant to you. And let's remember that PCOS can have some real health risks, so it's important to ask your doctors to get to the bottom of things fast. Lifestyle modification is extremely important in polycystic ovarian syndrome, and this includes dietary restriction, exercise, and weight loss. And it has been seen that just 5% weight loss of your total body weight can actually decrease testosterone and also decrease insulin resistance. So this leads to decrease in inflammation. And remember, acne is an inflammatory skin condition. So if you decrease inflammation, you improve acne. Topical treatment of acne is geared towards the prevention of microcomedone formation, which is the first step of acne lesion formation. It does this by correcting skin differentiation. Number 2, oil gland atrophy or physiologic death of oil glands, microbial control, and anti-inflammatory effects. However, I find that topical treatment alone is insufficient in the treatment of PCOS-induced acne. So another armamentarium of dermatologists in the treatment of PCOS-induced acne is the oral isotretinoin. So isotretinoin is a oral retinoid which basically is able to induce physiologic death or atrophy of oil glands. It can also correct skin cell differentiation. Basically, this leads to significant improvement of acne. Oral contraceptive pills or OCPs contain estrogen, and estrogen is able to directly inhibit androgen production in the ovary and indirectly through the suppression of the luteinizing hormone. Also, estrogen can increase sex hormone binding globulin, which basically decreases free testosterone. This eventually leads to improvement in acne. Combination OCPs also contain androgenic receptor antagonists such as cyproterone acetate and drosperinone. So they actually prevent the action of androgens in their receptors, thus also improving acne in the process. Other treatments like androgens act through competitive inhibition of androgen binding receptors and also inhibit 5-alpha reductase enzyme, thus decreasing production of androgens as well. So examples of these are spironolactone, finasteride, and flutamide. In my opinion, PCOS treatment should not be delayed because this is important since PCOS can involve multiple organ systems. So PCOS may actually lead to menstrual and fertility issues, and also there might be concerns about development of endometrial cancer. So your OB/GYN will be able to monitor you and guide you through these issues. So in PCOS, there is dysregulation of hormones and other chemicals in your body, leading to hyperandrogenism, diabetes, obesity, increase in bad cholesterol, decrease in good cholesterol, and also glucose intolerance. So there are dire consequences of these medical conditions. So an endocrinologist will be really helpful in terms of this. So a dietitian is very important, as patients would need a well-balanced diet that is high in fiber from fruits and vegetables, and careful to avoid sugars, dairy, and also avoid processed foods and processed carbohydrates. So psychologists and psychiatrists also have a played role in PCOS because PCOS can actually threaten the identity and self-esteem of a woman because of the aesthetic changes in her skin, hair, and weight. Also, PCOS can threaten the well-being of a woman because of the implications of infertility. So the most important collaborator in this aspect is the patient. So I advise that the patient still try to maintain a positive outlook and also follow the advice of her doctor. And so if you have any questions regarding this video, please do message us, and we would love to hear your comments and your feedbacks. So I hope you found this video very helpful, and I will see you in the online clinic. Bye!